Welcome to the Mama Stay Fit podcast. In this episode, we will be sharing our personal experience exclusively breastfeeding our babies over the past several years. Welcome to the Mama Stay Fit podcast. This is Gina, perinatal fitness trainer and birth doula.
And this is Roxanne, labor and delivery nurse and student midwife.
And this is the Mama Stay Fit podcast, where we empower you on your prenatal fitness, birth, and postpartum return to fitness journey.
Our podcast shares how to move throughout your pregnancy to stay strong and comfortable. Pain is not a requirement of pregnancy. Understand the science of birth and how to approach recovery after birth.
We share our personal experiences as mothers navigating the stage of lives, plus our professional expertise as birth workers and fitness professionals.
Our goal is to help you feel confident as you navigate the perinatal timeframe for an empowering pregnancy, positive birth, and postpartum journey.
We are glad to have you with us on this journey and that you've chosen us to support you. For today's episode, we also have Casey Backus, a physical therapist and yoga teacher here with us, and Dr. Jordan Hubbard, a functional dentist, who are also going to share their personal experiences breastfeeding and their professional expertise. We each have had a different journey with nursing, and we wanted to share our stories to help you navigate your unique journey. So I've been nursing a baby for the past 6 years now. I'm not nursing a 6-year-old. I have had 3 different babies that I have nursed it feels like almost like nonstop since June of 2017 when my first child, Adeline, was born. I nursed her for about 2.5 years into my pregnancy with my son. And then around the end of the first trimester, we weaned because it was really uncomfortable. And then I nursed my son when he was born in June of 2020 until he was about 18 months, and then weaned again during my pregnancy with my third baby. And Sophie's here now, and so we've been breastfeeding since October of 22 now, and we'll probably, hopefully, nurse for until she's at least like 18 months until we decide to have our fourth and maybe final baby. I keep changing my mind every time we have a baby. I want one more.
So I have been breastfeeding my kids for 4 years almost. My daughter was born in May of 2019. She nursed exclusively throughout my pregnancy. So even when I was pregnant, she wanted to continue nursing, and I cannot say no to her. I have a problem when I say no and she cries. I just give in. So we nursed throughout my pregnancy, and then we did tandem feed with her after my son was born in June of 2021. My daughter eventually did stop nursing, thankfully, because it's very hard to tandem feed a toddler and a newborn. Don't recommend if you don't want to. My son is still breastfeeding to this day, even though I am pregnant. I am 17 weeks pregnant with my third, and I still have the same issue of not being able to say no. So he continues to nurse, and it's just a lot easier to just put him to sleep when he is nursing. And I plan to breastfeed this third baby.
Hey, this is Casey, physical therapist and yoga instructor and mom to 2 little boys, age 5 and now almost 4, 2 C-sections, and I nursed both boys. First son, Bodhi, was born in June of 2017, and we nursed through, I think he was like 15 months. I was pregnant with my second son at that time, and he started to, I think, have some aversions to the milk and was biting me and saying yuck. And I was like, it's fine by me. Like, I'm good if you're good, so we're done. Which is maybe an exaggeration because I was pretty emotionally connected to breastfeeding, but I think there's something about knowing that you're going to get another shot maybe with the next baby that makes letting go of the nursing relationship maybe a little bit more tolerable. And then nursed my second son from March of 2019 until he was almost 3. And it kind of started out that we were just going to continue kind of a pandemic baby. His first birthday was right when everything lockdown happened. And so I was like, okay, I'm just going to see what I can learn about this. And I know there's some like immune coverage from breastfeeding. And so this is the best thing that I can do. So we'll just keep going a little bit longer. And yeah, spoiler alert, we know how that worked out. And so then he was nearly 3 and happy to continue breastfeeding. But we are finally weaned. I was pregnant or nursing for 4 years straight, I think. So yeah.
Hey guys, it's Dr. Jordan Hubbard, but these ladies are going to call me Jordan in this more informal setting here. I have 2 babies, my 3.5-year-old and my almost 2-year-old. I breastfed my first for approximately 4 months, but I was one of those people with an oversupply, and I had over 1,800 ounces of milk in my freezer, and so he exclusively got breast milk until he was a year old. And with my second son, the same thing happened. We breastfed until he was 5 months old when we weaned, but he got exclusively breast milk until he was 12 months old as well due to an oversupply and freezer stash.
So a common question that we receive either just like at me as a nurse immediately postpartum or just us on Mama Stay Fit is, do I have breast milk immediately after birth? It's a very common concern that you feel that you might not be able to feed your baby immediately after birth. And you do have breast milk. So it is called colostrum, and it's a very thick, nutrient-dense milk because our babies' tummies are very small. So they need to like jam-pack a bunch of nutrients in a smaller amount of milk. So our babies' tummies are about the size of a marble when they're first born, and then it slowly, gradually gets larger over the first week after birth. So by having this thicker colostrum for the first few days after birth, this is what allows the baby to get all of the nutrients that they need. Our milk will start to slowly transition from that colostrum to what we call mature milk over the first few days. So the range is between 3 to 5 days after birth is when your milk will start to transition. So a lot of people, if you're choosing to exclusively pump from the beginning, will get very concerned because when you go to pump, the colostrum is so thick that it doesn't really come out using a pump because the pump is just not as effective to get that thicker colostrum out as our babies' mouths are. So usually latching the baby to get that colostrum or using hand expression is a better way to get that colostrum out versus a pump. And that is also a great way to find out that you actually have milk, just to give you that reassurance, is to do hand expression. So how we do hand expression is we put our hand onto your breast. You can do like 6 o'clock and 12 o'clock with your fingers, and then you're going to gently push back and then pull forward towards the nipple. And you should see just like tiny little like amounts of milk will come out, and that is the colostrum. It's more clear, and some are like a kind of a golden tint, and that is just a sign that you do have milk so that your baby is able to get something. As your milk starts to transition into that mature milk, that is when a lot of people are going to experience engorgement. So engorgement is just like a ton of milk, but it's also some inflammation of the breast. And this is due to our bodies not knowing how much milk to make for our babies. So our body is just going to make a ton of milk. Whatever the baby takes out, it sometimes can take up to 2 weeks depending on the person. But once that baby is starting to drain the breast, our body will learn how much milk your baby is actually drinking. And then that's how much your body will eventually make. So some people are very concerned because those first couple of weeks, you feel very full before your baby nurses and then will feel almost empty afterwards. And then once your body stabilizes, you no longer have that full feeling where your breasts are really hard before the baby nurses. And that's a concern that, hey, I'm no longer making milk. It is completely normal. It's just your body getting used to. It's regulating, so it's creating only the amount of milk that your baby actually needs rather than creating an oversupply. With engorgement, a lot of people, it's very uncomfortable, so they'll start to pump or use some like pumping tools to drain the breast because that's how they think it's going to make it feel better. But this actually could lead to an oversupply because you are draining the breast, and that's telling your body again that your baby needs a ton more milk than they're actually able to eat. And that can lead to just an oversupply and continuing to need to pump to kind of drain the breast completely to avoid clogged ducts, mastitis, and other common issues associated with an oversupply. How do we know that your baby's getting enough milk, whether breast or formula feeding? And how do we know you're making enough milk for them to drink? So we're going to look at how many wet and dirty diapers they're having as well as their weight gain. So they should be gaining a certain amount of weight every single day, like 1 to 2 ounces, depending on how old they are. And then they should be having 6 to 8 wet and dirty diapers every single day. So if you come in and your baby is not getting enough wet and dirty diapers and they're not gaining enough weight, and then you notice like their temperaments, like they're extra fussy, like they're crying a lot more than you feel is normal, this could all be a sign that the baby is still hungry and that they are not getting enough to feed them to help them grow.
Let's take a break from this week's episode to hear from one of our sponsors, Needed, a nutrition company focused on optimal nourishment for the perinatal journey. We need choline to support our baby's neural tube formation and cognitive development, as well as for our own health benefits. But many of us are not getting enough choline in our diets, and most prenatals include only a bare minimum amount or none at all. New research also suggests that we need double of the current recommendations. That's one of the reasons I love Needed so much. Needed's core products contain choline, plus they have a choline add-on. I highly recommend adding Needed's choline onto any prenatal vitamin you are taking. To get started, head to thisisneeded.com and use code MAMASTAYPOD for 20% off your first order or first 3 months of a Needed subscription. So in each of our journeys, we have all had our own struggles with feeding our baby, and breastfeeding can be a really stressful time for a lot of us because we're essentially our baby's only food source, and that is like very overwhelming. And fortunately, we have a lot of options available to us now if like breastfeeding isn't working out or if you don't want to breastfeed, like formula feeding is a really great option for a lot of people. But if you want to breastfeed, there can be a lot of struggles associated with it. And so for me personally, with my first baby, we had a really painful latch for about the first week or so. And I think it might have been related to like us trying to learn how to breastfeed together because your baby's brand new and like you're brand new to breastfeeding. And like we think about it being this like supernatural experience. But neither of you are skilled in it. And so there is like a learning curve involved with it. And so for my second, I already knew how to go about breastfeeding. And so it was an easier journey. But for my first, we were both like brand new to the game. And so we had a longer labor and like I think she had a lot of like body restrictions just from the labor process. Like we pushed for like 2.5 hours and she had her hand up by her face, which is where her jaw is and her tongue is. And so there might have been some like things that occurred. And so I'm trying to figure out how to get her latched and she's trying to figure out like why she's not inside my belly anymore. And so I had a lot of nipple damage initially that made the latch really painful for us. The first like 2-ish weeks was my nipples essentially just healing from the damage that had been caused of like trying to learn how to breastfeed. And so I'll tell my doula clients that breastfeeding is not necessarily the most comfortable thing ever to begin with because like I have never had somebody suck on a part of my body like nonstop before. And so there's going to be some soreness involved with that, but it shouldn't be painful. And so things that like I advise my clients to look for when they're learning how to breastfeed is you should feel almost like a tugging or pulling sensation, but not like a chomping, pinching sensation. If you're feeling more of that chompy, then we want to release the suction on the nipple. And so usually you'll do this kind of like fish hook in your baby's mouth where you'll break the seal of suction and then work on relatching them. And there's a lot of different techniques involved with that. And if you listen to our last episode about tongue ties, you'll better understand like how the oral development of our babies can really influence how well they can get a latch as well. And so with my daughter, we eventually worked through that nipple damage and we went on to have a really great breastfeeding journey for about 2.5 years. I had like some clogged ducts here and there, which were probably related to how well she was removing milk from my breast. And so when it came to preparing for my second breastfeeding journey with my son, I had like all of the clogged duct remedies like ready to go. I had like Happy Ducks tincture. I had the sunflower oil stuff. I can never pronounce what the name is. So I had all the things ready to help with breastfeeding. And we ended up having like this perfect breastfeeding journey, which is like, I always feel bad like saying it, but like he had a perfect latch from the beginning. Like we had a much shorter labor. Like maybe he just had like less trauma involved. He kind of flew out of my body. So I didn't push for very long with him. And so his latch was like pretty great from the beginning. I also had more experience breastfeeding and like teaching other people how to initially latch their baby and had no clogged ducts with him. And it was like a pretty easy journey. And then for Sophie, my youngest, she did have more like body tension. And so her initial latch was a little bit more like chompy for me. And then we took her to see some body workers. And so we saw like a Webster certified chiropractor and we did cranial sacral therapy on her. We only did like one session for each of them. So it wasn't like a prolonged period of time. Just because birth can be a lot for our babies. And so we went and saw some body workers to help kind of release tension that she had in her body. And then her latch was a lot better from there. And we really haven't had a lot of issues with like milk removal or clogged ducts for me personally. And so my first breastfeeding journey really influenced how I prepared for my subsequent ones.
So my breastfeeding journeys were slightly different than Gina's. So with my first, I had really painful latch from the get-go, kind of like initial feeding. And I thought that I had been a labor and delivery nurse for like 5 years at this point. I was like, I got this. Like I teach everybody how to breastfeed. So like I can breastfeed my own children, no problem. That was false because I could not get her latch to not be painful. I had a ton of nipple damage. I had to stop nursing on one side at a time and just exclusively pump on certain sides because it was so painful to latch. It was 3 months of this because I was determined that she did not have a tongue tie and I could just fix it, which probably is a little bit of my personality and probably says something about me as a person. But eventually she did get her tongue tie revised and that changed our breastfeeding journey a ton. Her latch was no longer painful. We continued to nurse until I think she was almost 3, if not after 3. I can't remember because life is a blur. But I had a lot of clogged duct issues with her because I think it was more so related to the clothes that I was wearing. I was wearing really tight bras at certain points. That was probably restricting milk flow, but also probably related to tongue tie as well. But with my son, when he was born, I had no issues. His latch was not painful at all. I felt like he was completely draining and I thought that everything was fine, but he ended up having colic pretty bad and had reflux, silent reflux. And it was a long journey and then a whole nother issue as well, tongue tie related, I'm sure. He did eventually have to get his adenoids taken out because I'm sure he's allergic to something that we can't figure it out. So he had a lot of inflammation in his body. But this all affected my breastfeeding journey because when he wasn't able to breathe out of his nose because his nose was clogged, he would bite me once he had teeth, and that was not fun. So he got teeth pretty early compared to my daughter. My daughter didn't get teeth till she was 9 months old, which I'm sure relates to tongue tie as well. But she didn't get teeth for a while. She had 2 teeth, I think, at her first birthday, and it was really cute for pictures. It was I'm sure this is probably not normal. But my son got teeth a lot earlier, so he started biting me and would laugh about it, which didn't feel great. Was related to when he wasn't able to breathe out of his nose, he needed to breathe out of his mouth. So he would bite me to stop the milk so he can then breathe in between nursing, which was never super fun to experience. Eventually, he is doing a lot better now, but now I am pregnant. So lots of discomfort associated with nursing, but I can't say no. So we are continuing on. So my daughter continued nursing after my son was born. So we tandem nursed my almost 2.5-year-old daughter and my newborn. And I had heard of this thing called DEMER before, but I had never had personal experiences with it or knew anybody that experienced it. But it is dysphoric milk ejection reflex. So D-MER for anyone that wants to Google. This is an abrupt emotional drop that occurs in some of us just before the milk ejection reflex occurs that only lasts for a few minutes. But it's this feeling of incredible negative emotions that range in severity from just feeling a little bit sad or angry or something to almost feeling impending doom, almost hate yourself or it's very negative of feelings. I didn't enjoy it. It would just last every time I would only feed my daughter that I would feel the world was ending. And I would just cry and then it would feel better after a while. But at that point, I'm throwing her across the room to get off of me because I'm what is going on? It took me a couple times, probably a couple months of feeling this. I just associated with my body saying she needs to just stop nursing, then relating it to this dysphoric milk ejection reflex. But some people will only feel this when they breast pump versus when they actually nurse their babies. So they then will just stop pumping whenever they're out and about. They just will refuse to pump because no one enjoys this feeling of impending doom. So it is normal for you to not feel it every single time you have a milk ejection reflex. You may only do it when you pump or only sometimes when your baby latches, but it doesn't feel great. So it's definitely I've had people tell me that they stopped breastfeeding because of this reflex. And I can totally relate that we definitely started to wean my daughter when I started to feel this. And hopefully I don't feel that if my son continues to nurse with this baby after they're born. Hopefully he'll stop before, but no guarantees.
So my first breastfeeding experience was relatively uncomplicated. My son latched pretty well. It seemed pretty simple to me, which I know is not the experience. I now know after having a second experience that was not simple or rhythmic or even I had kind of aversions to nursing. But the first time around was pretty smooth and I loved it and it just seemed this is something I was supposed to be doing, and it worked for both my son and I until about 4 weeks in. that I developed mastitis, and it was fast and quick and violent and almost resulted in a hospital admission. But I have a way with words, and I begged my way back to my car with really strong antibiotics and physically felt like I could not be away from my baby at that point. And they were like, yeah, it'll be like a 3-day admission. You might need IV antibiotics. Your blood work looks really bad.
At this point, Casey had texted me a picture of her boobs to show me what mastitis looked like. And it was, I probably still have it saved on my phone.
Totally, I got it.
The beginning of Mama Stay Fit OnlyFans.
It was wild, and I think I probably had a clog that I didn't know was a clog. I don't know if I had a little nipple damage, but basically, it was infected, and it was fast. I was violently ill. I called my husband to come home from work and lay the baby down and was like, oh my gosh, I can't even think straight to drive. So just know that if you experience mastitis, it can be wild. It can be much milder than that, and a clog can be just like a sore breast, but it was really wild and humbling. And after that, breastfeeding, I would say it took a bit of a mental toll for me because I was having to really be conscious about draining both breasts. So I was then nursing, like applying this antibiotic, antifungal cream, taking my antibiotics, and then also pumping after that. And it was just a really exhausting anyways. But I want to say that stopped our nursing relationship almost in its tracks. And it took maybe about 6 weeks to really recover a rhythm where it felt easy. I wasn't constantly thinking about and poking my boobs to see if they were emptied and being kind of paranoid about getting sick like that again. It was humbling, and maybe in some ways in a good way that I was just more attentive, because I think it does require a bit of mental attention to emptying. I was fortunate to be home with my kids for an extended period of time, so I definitely can see that being in the physical proximity, with my kids, that definitely made it much more doable for me to continue nursing for a long period of time. But it was relatively uncomplicated. Nursed my first son through teeth and through a second pregnancy. Not through a second pregnancy, but I think, as I mentioned earlier, he started to bite at 15 months and just say ick. And it almost was like he didn't like that the milk was changing or something, that the taste of the milk had changed since I was pregnant. And my husband just kept saying, it's okay to stop. Just don't do this. Why are you doing this to yourself? And I think I just didn't know the off-ramp. I was like, I think I do want to stop, but I know this is good for him, and I don't know. And then we eventually stopped, and I knew it was the right time because it felt like a little bit uplifting, a little bit sad for maybe, I don't know, I want to say maybe a week or so, since that was our special time. But that kind of was the beginning of creating space for the second baby that would join our family. And so it gave me about a 5-month break, if pregnancy is a break. Not nursing, but being pregnant. And the second nursing experience, man, it was freaking rocky. We had latch issues, which I now understand are tongue tie and airway related with my second son. Couldn't get a deep enough latch, and my nipple would always look like a tube of lipstick after he nursed, which I knew was kind of a cardinal sign. And I really didn't have the knowledge back then or the resources or kind of support network in the tongue tie realm that I do now. So we just kind of worked through it, and our nursing sessions were really long. I felt myself averse to nursing. If he would cry and a family member would bring him to oh, I think he's hungry. It's it would almost be rage inducing. I don't want to do it again because the first maybe minute or so of the latch was really painful. My nipples were damaged. Silverettes did save the day, I will say. The silver nipple covers. Silver, we know in healthcare, has really great healing properties and is used in wound care, but I found these in a late night doom search on the internet and text Gina. I'm like, I'm trying these. I look like Madonna when I put these in my bra, but I know that silver can heal, and I'm just going to try it. And so you squeeze a little bit of milk out into the cup and then put the cup on inside your bra. And I swear it was magic. My breast healed almost overnight. And that was really kind of a big step toward achieving more of a ideal nursing or I would say a nursing relationship that worked for both of us. I mean, he loved to nurse. He never had a problem, but it just was uncomfortable for me. And that nursing relationship continued and went on and on and on. And that boy loves his milkies. So almost 3 years. And I think I mentioned that, continued a little bit because he was a baby and we were home together during the pandemic, but it just continued to be something that worked for us. And I think when I let myself release a little bit of like, he's too big to be nursing, like I should stop because this is weird that he's over 1 or then over 2 and still nursing. When I let that go and was like, it actually kind of works for us and it makes sleep and it's soothing for him and there are health benefits. We know that the WHO says now that 2 years is can be really helpful. There can be benefits. We know the milk changes as they grow, and I was with him and home. So we eventually stopped. But so that was our story.
So for me, I had something similar with Adeline, my first, with not knowing when to stop because it was essentially just me and her for most of my postpartum experience. My husband was deployed a lot and he worked really long hours. And so breastfeeding was like this super special time for us. And I had like a lot of anxiety at the end on stopping it and kind of losing that experience with her because it meant that she was like growing up. But then I got pregnant and it was horrible like to breastfeed and be pregnant at the same time. And so that like, oh, I don't want her to grow up like feeling went away very quickly. And I was like, we're done. And so what I did was I would just do a countdown from 10. And when I reached 1, I would unlatch her and we would be done. And eventually she just stopped asking for it. But I had a similar feeling of like, I don't know when to stop. Like, this is so magical. And then it quickly just changed for me. And I was like, we're both done. We're good.
Okay, so I'm going to preface my story with you don't know what you don't know. And I think that goes hand in hand with my breastfeeding journey. So with my oldest son, we had an extremely successful latch right out of the womb. I was so happy and it was this truly magical bonding experience. And I absolutely loved breastfeeding him. And I know the benefits of breast milk and how good it is for baby. But I quickly learned I had an oversupply. And my mother had told me that she had this as well with both me and my sister. It was something that I kind of learned to deal with. It never really bothered me. I never had anxiety about it. I had my Haka and it would catch the extra milk. I never did extra pumping. I never did pumping after he ate. I really just had my Haka. I am a working mom, and so I would pump at work and I would get over 16 ounces every pumping session. And I just had a lot of milk. I mean, my baby ate a lot too. He was in the 98th percentile. He still is. And so I had big babies, but I collected that milk and it was very special to me. I think every woman knows how important that liquid gold is. And I felt emotionally connected to that milk. I had others around me who had babies who were 3 and 4 years old and they had all this extra breast milk in their freezer. And they were kind of like, what do I do with it? And the thought of having to throw away breast milk to me gave me so much anxiety. And I was like, I don't want to be that mom with all this extra milk in my freezer and not know what to do with it. And at one point I had over 1,800 ounces of milk in my freezer and my baby was 4 months old. And I was like, you know what? We kind of did a lot of math, my husband and I, and we realized that if I had started weaning, that would support him until he was a year old. So I started weaning and so we were officially done around 5.5 months, I think. He had exclusive breast milk until he was a year old. I'm a super independent person too. I love my children, don't get me wrong, but I was very happy to have my body back. And so that's what worked for us. I know there are things I could have done to help reduce my supply. Now I know that, but again, that's just what worked for our family. And so when I had my second baby, I knew that I would likely have an oversupply as well, but I almost looked forward to it because I knew that that meant I could have my body back again. And so with him, again, I did have an oversupply, but in the hospital, I had a lot of pain when he was latching, and I knew that that wasn't normal. And I asked the lactation consultants at the hospital about it, and they were like, yeah, I think it's fine. You're just having pain. pain, that's normal. And I was like, no, that's not normal. And I know I had this journey with my first and I didn't have that. And being a dentist, I knew about tethered oral tissues, but at this point, this was prior to being educated on them. And so I am not joking. I got on YouTube and I looked some stuff up and I saw that my son had a lip tie and he was about 2 months old and I had been going through this pain for a while and I had a laser at my office. And so I watched 2 YouTube videos and I went to my office and I lasered his lip. Don't do that. Okay. I don't recommend that, but that's what I did. And I now know that, having a lip tie usually means you have a tongue tie. Again, this was prior to my education, but I immediately nursed him after his revision of just the lip. And I wanted to shout from the rooftops that I could help mothers. It was life-changing. It didn't hurt. My nipple wasn't sore. He was happy. It was truly a miracle. And that is what started my airway journey in dentistry and being trained properly in tethered oral tissues. But it is kind of how I found my passion. And it is kind of how it changed my outlook on my breastfeeding journey with my son. And so I continued to have the oversupply like I did with my first, and I continued to store milk. And about 4 months in, I was getting ready to wean, and my freezer door got left open and I lost 500 ounces of breast milk. Luckily, it wasn't my whole stash. At that point, I had about 1,700 ounces, but it was still significant. And the thought of having to continue breastfeeding longer actually made me upset. Having 2 babies and I had just started a business, it was extremely overwhelming and I just needed time back for myself. I wanted to wear what I wanted to wear. I wanted to not have to worry about pumping and feeding. I wanted to be able to rely on others to help feed my baby, and it was daunting. I screamed and cried, and I'm sure my neighbors thought there was some crazy woman in the garage, but it was horrible. And so my husband and I talked about it. I did continue feeding him for longer than my first just to catch up with things. So I did breastfeed him until just around 6 months to make up for that lost stash. But when I stopped breastfeeding him, I still had that 1,700 ounces in the freezer. I had built it back up, and he did also exclusively have breast milk until he was about 1 year old.
So I can definitely appreciate the desire to want to have your body back, because I feel like I haven't had my body in like 6 years since I've either been pregnant or breastfeeding continuously since then. So I'm really excited for the 3 years from now when I finally get to just be myself and like wear whatever I want to wear, unless I have another baby. But yeah, that sounds amazing. So something that was super stressful for me before my first was born was I would see online a lot on how people were like attacked for breastfeeding in public. And I think maybe it was a thing in like prior generations where breastfeeding was very shamed upon. I know for my dad, when he was a baby, he was telling me that his mom was given like medicine in the hospital to stop her milk from coming in. And so breastfeeding is definitely something that I think is newer for our generation and maybe the generation prior to us, because our mom, for Roxanne and I, like we were breastfed. I was only breastfed for a few months before the pediatrician told my mom that I was allergic to her milk. And so there was a whole story involved with that. But I don't think breastfeeding was super common until like maybe the more recent like decade or so. And so I went into my first breastfeeding journey thinking that anytime I breastfed in public, people were going to like attack me and shame me and like yell out to me. And so it made me super anxious about nursing my baby outside of my home. Like I bought all these breastfeeding covers and was just really nervous about it. And then I breastfed my baby in public and literally nobody said anything. And I've been nursing for about 6 years now. And I think the only thing that I've ever had happen was someone was like, that's amazing what you're doing. That's really cool. So most of the time, if anyone even speaks to me as I'm nursing, they compliment me or they tell me that that's really cool what I'm doing. I had like one like waiter in a restaurant who like felt like he was interrupting me and was like, I'm so sorry, and walked away. But I didn't feel like that was being shamed. But this thought that people would attack me if I was breastfeeding like made me super anxious before my first breastfeeding journey. And I was just wondering if you guys had experienced anybody shaming you or if you had this similar sentiment.
I too was super nervous about breastfeeding in public, and I don't know where it came from, but I was gifted all of these nursing covers at my shower with my first, and I did use them, but I quickly realized I really didn't have to. Like the way my baby was on me feeding was covering anything that could be construed as negatively anyways, but it also wasn't ever looked at that by anyone that I nursed in front of. And I agree with you that, this scare tactic of me, nursing in public was going to be so bad. I always had to make sure I never left the house without a nursing cover, and that I always had to make sure I had something, a scarf or something to cover my baby up, which just turned out to not be true.
Similar for me. I thought that, I was gifted. It's so silly to even think this in hindsight, but that we had all these nursing covers is just this what an announcement of here's how you shall cover yourself. It's like giving somebody a bra or something like that. I learned pretty quickly, I nursed at home without the cover, and then I really didn't like it. And so I tried it a few times in public, and then was lucky enough to have people like Gina in my life who was navigating her breastfeeding journey with her first, just a week difference than mine. And I saw her nursing, and I was like, yeah, there's nothing weird about that. I can do it too. So I just kind of started getting more comfortable with it myself. And I don't have any stories to share. It's kind of like the Dr. Seuss, I nursed him on planes and, in the park and in restaurants or anywhere that when he was hungry, he got to eat for both kids pretty much. So thankfully, just scare tactics and shaming, but no real bad experience.
So I feel like I've never had shameful experiences. And again, I also had, experienced Gina for 2.5 years almost breastfeeding Adeline, just with no cover. She was very comfortable. It was never this weird thing that kind of happened. So when I got pregnant and had my first daughter, it was never trying to cover up. The only times I would cover up were when it was really sunny out. I would just use it to block the sun, because she would feel like she was crunching her eyes so much. The sun was assaulting her. So I would just shade her from the sun with a blanket if I had one. So I leak milk constantly for the first few months postpartum. I think I would soak through towels when I would sleep at night. I literally soaked through an entire bath towel one night. So the only time I would use some sort of cover was for the first couple months, because my other boob was literally shooting milk out at the same time she was nursing if I was out in public. So I needed to have something to collect it. I wish I had 7 arms for those first few months. And so having a cover just allowed me to literally whip my other boob out to put a haka on without having to show everyone my nipples, so that I wasn't just wasting that milk. Also, never waste milk. Even if it sits in my freezer for 4 years, just never waste it. So that was probably the only time that I wore covers, was just so that I wasn't flashing everybody with my other boob that was shooting milk across the room. I feel the only time I've ever had anybody say anything to me while I was nursing was hey, do you need to sit down? Hey, or there's this chair here, that you can nurse in. Or to offer hey, if you want some privacy, we offer this nursing room that's on level 3 or just down the hall. People were always very accommodating and very sweet and nice about it, trying to make sure that I was the one that was comfortable, which I really appreciated, because I did think that I was going to have to fight to feed my child, fight all the people that are going to come for me for whipping my boob out to just give my child a meal.
So for me, the nursing covers can be helpful when my baby has FOMO and wants to look at everything. And so that'll be the one time, Sophia is pretty guilty of it right now with wanting to look around a lot. So a cover sometimes helps her for that. And I definitely think seeing breastfeeding be normalized in social media and seeing folks breastfeeding in my life has definitely made me a lot more comfortable doing it. So I think there's some validity to that. But I think the story that's being generated on you have to be ready to fight for your breastfeeding rights is maybe a little exaggerated or maybe outdated at this point. And so if you're feeling anxiety about feeding your baby, you probably don't need to, and just do it in a way that's comfortable for you. And so some folks do want to be more covered because that's more comfortable for them. Some folks don't want to be more covered because that's more comfortable for them and their baby, and that's fine. So I've never had anybody say anything really negative to me. Maybe they've whispered to each other, but I didn't hear it, so it doesn't exist. But it's not real. So what were your all's favorite memories or stories while you were breastfeeding? I know for me, probably my favorite moments is when I am like playing and scrolling on my phone and then I look down and realize that my baby's been staring at me the whole time with these big doe eyes. And I'm like, oh man. But then we just lock eyes and we just have this moment together where they're feeding from this like magic milk fountain that can literally make anything into milk, which is a superpower. And that's probably like my favorite part about breastfeeding is having this one moment that it's just me and my baby. And they're just like looking right up at me and I'm looking right back down at them. And I stop scrolling on my phone for like 5 minutes to bond with them. I don't know how anybody did this prior to having a phone. Like, did you just stare at the wall? Like, I don't know what you did, but those moments where we just read a book, you need 2 hands to hold a book. Maybe that's why everybody had wallpaper to be able to have something to look at. So my favorite part about breastfeeding was kind of that one moment where like you and your baby would lock eyes and just be connected to one another in this super magical moment. So I guess what were your all's favorite memories of breastfeeding?
So for me, probably my favorite moments were not necessarily just like the breastfeeding and all of its benefits, like, and I knew, but it was when they would get hurt and they wouldn't want anybody, but they would want mom. They would run to mom as they're just bawling their eyes out because for whatever reason, they like dropped a toy and they were so upset and all they wanted was like mom to hold them and drink milk. I felt so needed and wanted, and like I was the magician that would heal all of their sorrows with just my magic milk for anything. Anytime like milk was not the answer, like as they got older, that milk stopped being the answer, I would just be like, I don't know, that's my only power.
That's all I got.
What do you mean milk is not enough? And that was probably a hard transition too also, and also it's like no one else could soothe them, but I am the magician to my children with my magic milkies, could soothe them instantly. Yeah.
I have a really similar experience. I often said when they were toddlers, I'm like, I really don't have skills outside of breastfeeding. Like, I'm not the mom I think I am when I'm breastfeeding versus when I'm not breastfeeding, because it's the coping strategy. But we've talked on the pod about imposter syndrome before, and I think growing a baby doesn't necessarily make you feel like a mom, or birthing a baby doesn't necessarily make you feel like a mom, but when you can soothe your baby or when you are the answer to your baby's problems, they're wanting to be with you and connected to you and nurse, and like that to me really helped me step into and embody the role of the mom, because like Roxanne said, it was like, it's only me. And actually, I think, well, I probably would tell my family this too, like then I consciously didn't pump because I was like, this is my thing. Like I don't want anybody else to feed my baby right now, because that was like me kind of trying to find my identity as a mom, and like we could probably like dive into that deeper. I was transitioning home from working and like deciding to be a stay-at-home mom, which was a whole transition in and of itself. So like being good at that, good in quotation fingers, right? Because just, feed your baby however it works for you. But that was important to me because I needed, like, there were no other accolades really in my life. And that just felt like really special. Like I was the important person. And yeah, I think that, and then like the connection, like Gina said, just kind of looking at your baby, knowing that your body did that. It's probably the kindest, like aside from pregnancy, it's probably the kindest I've ever been to, I don't know, like the most peace I've had with my body, because I was like, this is really cool. Like I can't believe that I had this superpower and I didn't know that I was going to be good at this. So yeah.
I think my favorite moment breastfeeding with both of my kids. So I'm a very introverted extrovert, and I love going to all the parties and all the events, but man, if it doesn't suck the life out of me sometimes. And so having my baby there was my excuse to step away because I had to breastfeed. And so I got to go in a quiet room and just be with my baby. And it was quiet and they made their little sucking noises like they do. And it was just so peaceful. And I think that also helped me bond with my baby. Like, hey, I know we were just in this really loud place with a lot going on. And now we could take a step back together and just be together and do the one thing that only you and I can do together. And that was really special.
So thank you so much, Jordan and Casey, for being here to share about your breastfeeding journeys. Each of our journeys is so unique, and for those of you that are listening, your journey will be unique as well. And the things that are important to you may be different from us. Hopefully you can see that each of us kind of had different priorities when it came to feeding our babies as well. And all of those priorities are valid in their own ways. If you enjoyed listening to this episode and you want to listen to more, make sure to follow our podcast wherever you listen to it. We release new episodes every Wednesday. This podcast is sponsored by Needed, a nutrition company focused on optimal nourishment for your perinatal journey. Use code MAMASTAYPOD for 20% off your first order.